The Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
We have these not one but two doctors from Pattaya, Bangkok Pattaya Hospital, talking about active ageing with a focus on preventing hip and knees issues, right? So through exercise, etc. And there'll be a little exercise class at the end. The speakers today, we have two speakers. Our first speaker is Dr. Nammon, of course, from Bangkok Pattaya Hospital, who is an orthopedic surgeon. Welcome, Dr. Nammon.
Good morning. Thank you for having me today. I have the chance for talking about the hip and knee replacement and arthrosis in the last couple of years ago, right? For PCEC, right? Today, we talk about the hip and knee pain in the advanced age or active age. Okay, so I will spot in the like the cause of the pain and the pain and the treatment in terms of orthopedic view. All right, another doctor will talk about the physio right later. Okay, so firstly, we talk with the hip pain. All right, the possibility cause of the hip pain that is come from the like the injury, inflammation, or structure problem of the joint by itself or surrounding soft tissue. Okay, so the locate of the pain, the location of the pain. This is like the clue that we will spot and diagnosis about what exactly condition of the cause of the pain, right? So we talk about the outer hip first, right? This is like the soft tissue surrounding. The thing that it possibly cause is like the muscle and tendon around the hip joint, right? The overuse or sudden movement that irritation to the tendon or tear of the muscle or injury of the muscle. This is the common cause of the activities or athlete or exercise, okay? Another thing like the bursa is like the back around the hip joint. Okay, so this is like the normal situation of the bursa is like the flat back, right? No content inside. But if you have like the repetitive trauma, repetitive exercise, and it cause of the bursitis or inflammation, it can cause of the fluid inside. This is from the, like the soft tissue produced about the inflammatory process inside that cause of the pain as well. So another thing that it can cause of the pain around the hip is like the refer pain. Mostly that's come from the spine, right? The degenerative spine, disc herniation, or sciatica pain that can cause of the hip pain as well. So we have like the clues of the, like the differentiate between the hip pain by itself and for the spine that refer to the hip. If it's like the pain from the spine, the refer pain, it should be coming down to the leg or foot, plus with tingling feelings, plus with the weakness. But if that comes from the hip joint or surrounding with the hip soft tissue, that should come from the hip, refer to the groin, refer to the thigh, but not below down to the knee. This is the typical symptoms of the hip pain from the hip joint. You see like the muscle around the hip, right? There's like the several muscle, like big muscle and strengthful muscle around the hip. This is in front, all right? You have like the several muscle group that form the hip joint around the hip joint. This is like the posterior and the lateral. This is the picture of the bursa, right? You have like the bursa at the lateral of the hip joint. If you have like the pain, all right, locally on the lateral side and feel like there's like the fluid or swelling locally, maybe you have to think about the bursitis as well. This is like the bursitis. it feel like the fluid inside that from the inflammatory process. Okay, this is around the joint. So we go to inside the joint. The hip joint is combined with the acetabulum. I mean, like the cup at the pelvis and the femoral head, right, from the femur, right. Around that, you have like the ribum. I mean, like the soft tissue, all right, like the ring cartilage is lined, like the around the hip, the acetabulum joint. If you have the injury with the, like the cut, like the ribum from the accident, from the repetitive using, you can have like the symptoms of the lock, click, catching, all right, sensation, and produce the painful to the groin, to the thigh, to the hip by itself. Femoral acetabulum impingement, or like the cause of the pain is the general is called like the hip impingement. All right, this is come from the improper anatomy of the hip joint. This is like the improper congruent of the hip joint. Okay, I will have the picture show you. Another cause of the inside of the hip pain is like the arthrosis condition or arthritis. All right, coxatosis is like the most common in adult. All right, just from the using by the age or by the secondary cause like the inflammatory or any cause that produce about the abnormality of the structure of the hip joint by itself. Okay, that will present by the stiffness and pain, right, at the groin area. Another condition is like the inflammatory joint disease, like the rheumatoid arthritis, ankylosing spondylosis. That it can happen like the inflammatory joint pain or hip pain as well, right? The less common is like the condition of the vascular necrosis. I mean, like the insufficiency of the blood supply of the femoral head. In this patient group, we will find it in younger age because of the hip femoral head is insufficiency of the blood supply. So the femoral head start to, like the dead, right? And when you have like the head dead, the structure of the head is going to be collapsed and not smooth surface. So when you have something that not smooth surface rubbing on the cartilage of another side, like the acetabulum, if it like the unraveling, so it can gonna be make you have like the osteoarthritis or deformity of the hip joint later, all right, in the long period of the time. Another thing is like the hernia, right? Another cause of that have to differentiate between the hip pain is like the hernia, inguinal hernia, infection, cancer, tumor, metastasis of the bone, or childhood condition. I mean, like development of the hip, like the hip dysplasia or improper developing of the hip joint since childhood. Okay, this is less common, but it can happen and develop like the hip pain in the future as well. This is like a picture of the labrum, all right, that I told you about the acetabulum and femur, right? Around the acetabulum rim, you have like the collagen tissue is like the, we call like the labrum. The function is like the same as the meniscus in the knee, right? To make the joint is stable and more congruent, okay? If you have the injury to that, you have like the, like the tear of the labrum, or, like this is like the lesion of the labrum tear. It can have like a longitudinal pattern or radius fracture, radius tear. It depends on the mechanism of the injury, okay? Femoral acetabulum impingement that I told you last time for the previously, all right, about the improper congruent of the hip joint. This is like the normal hip joint, all right. They have like the round and congruent with the femoral head and acetabulum. When you move, there's no problem with that. These two conditions is like the femoral acetabular impingement. We call like pincer. Pincer is like the bone spur, all right, that's come out from the acetabulum side, and when you move, it's going to be impinged, right? So that's the cause of the pain as well. For the cam, This is like the lumping or abnormal shape of the femoral head, right? That is like the something big and go inside the acetabulum cup. This is like the most common cause of the most common type of the femoral acetabulum impingement. All of this X-ray, this is my patient, all right? All of this is my patient that I've done in Bangkok Pattaya Hospital, okay? So this British male, 47 years old, with the left hip pain, okay? He's present with the left hip pain for a long time, on and off, and it depends on the activities, okay? So the X-ray show like there's like a mild arthrosis or narrowing of the joint space, okay? But the age is like the 47 and he's still active, okay? For sure, it's not like the indication to go on for the total joint replacement, right? So I did the MRI and it show about the, like the cam type of the acetabulum, femoral acetabulum impingement. That means the head is squished to the cup, all right? So that's gonna be make like the labrum tear and the myarthrosis condition right now. I talked to the patient and, discuss about the method of the treatment. The patient, agree about, try to conservative treatment first. At least, you can prolong about the time to go on for the hip arthroplasty in, maybe about 5 years, 10 years until, get older and older, right? So for the hip joint, the procedure in this case, I do like the cortisone injection and hyaluronic acid injection inside the joint. But for the joint, the hip joint is like a ball and socket. So it's difficult to, go in like the knee. Because of the knee, it's like the skinny area, right? You can find the point and put the needle in. That is no problem. But for this, I have to, bring him to sleep, okay, in the operating room. Use the fracture table, all right, to check about the lower extremity, to check and make the space of the hip, okay, under fluoroscopy. And I put the needle in, okay, inside. This side is like on the lateral wheel, all right, to check it out, to make sure that my tip of the needle is inside the hip joint, okay. So I put the injection in, and after that, we release the lower extremity and going back to the normal position. In this case, after the operation for the injection, he pain-free and he's clinical. In overall, he's getting better about, 80% compared with before the operation. But I tell him that I cannot guarantee about, the time. Because of this, it also has the mechanical problem as well. So that means, it should be, it can happen again, all right? So this is like the first case, all right? Next, we talk about the arthritis. It's like the degeneration of the hip joint, all right? It's composed by the primary and secondary, right? The primary is like by the age, by the using, it's like the 40% of the group. And another thing is like the dysplasia, like wrong development of the hip joint. This is like the 60% of all case. Okay. This is my case, all right, 70 years old British male. Yep, severe stiffness, right, and painful. When he visit me in the outpatient, he has to, sit on the wheelchair. He cannot walk. It's very stiffness. If he stand, he has to stand like the couching because he cannot extend the hip fully. And the hip cannot move at all. You see on the left side is worse than the right side. This is like the no joint at all. And the osteophyte, like the bird, like the bone spur is very, very severe, okay? So the thing that I've done is like the hip replacement, and I used about the special instrument or special implant to let him allow to, like the movement with the more stable of the artificial joint, okay? So the first one has done, and after about 3 months for the recovery, he can walk with painless. He can walk and move his left hip properly, right? His quality of life is getting better. Another 3 months later, he decided to do again on the right side. And right now, it's like the 6 months after operation, he returned back to the normal walking. Mobilization of the hip is very good. Okay, the quality of life is better. Okay. American male, 73 years old, right hip pain. In this case, I use like the new technique of the hip approach, okay? On the anterior approach, we call like direct anterior approach. It's less injury of the muscle and more stable of the hip prosthesis, okay? And less pain and early mobilization, early ambulation after the surgery. But for the anterior approach in the DAA, I mean like direct anterior approach, is not everyone can do that. We have to, like the select and has the indication to select the patient. Because of if we didn't select it and do it in everyone, high rate of the complication, it can happen. So some patient proper to that, some patient not. Okay. This is an X-ray of the anterior approach. Okay, the benefit of the anterior approach, we do the operation on the supine position, not like the lateral like this. So that means it's easier for measuring about the leg length during the operation, and it easier for the doing the X-ray intra-operation to adjust about the position of the hip prosthesis. Okay, this is after the operation. After the operation X-ray, everything in the good position and the hip quite strong. After about 3 weeks, he gonna be coming back for walk again. But the recovery that I told you is like the less injury of the muscle. So that means the recovery time is quicker, a bit quicker than the posterior approach or standard approach. Coming to the hip fracture, that like for the accident that it can happen in everyone, right? It's like the serious injury from the fall on the elderly patient, is particularly in the osteoporosis condition, right? And it's produced about the hip pain that it cannot bear the weight at all because of the hip pain, right? The aim of the treatment in the patient who has like the hip fracture is like to take the patient back to the previous stage of the ambulation as early as possible. Because of it, not a good idea for the, like the elderly patient or any patient lay down on the bed for a long time. It's gonna be, make the complication like the infection condition, pneumonia, bed sore, or, like the pressure sore, and mental status like the delirium is can coming very quick. So that means the aim of the treatment of the hip fracture is like to make the patient coming back to the normal stage of the ambulation as quick as possible, right? We have like the treatment option. Firstly, conservative. It's rare because of, for the hip fracture, it cannot heal by itself. So we call like the skillful neglected. That means the patient is like the bedridden, like the severe underlying disease and dangerous to take him to the operation that can make the further detrimental things happen. So that means we use like the skillful neglected. After about 6 months to a year, right? The fracture is gonna be healed by the fibrous tissue. The patient don't have like the true joint. He has like the patient has like the pseudo joint that it no pain, less pain, but it's not stable. He cannot walk properly because of it not like the real joint. Okay, so we call like the pseudo joint. But this method of the treatment we have to discuss with the relative, with the patient, something like that. Okay, because of the result is not good. Coming to the surgery option, all right, we have like the fracture fixation and arthroplasty. I mean, change the joint. Okay. This is like a Polish female, right? 76 years old. She fell from the, she was hit from the motorbike. You see, this is like the fracture. It's non-displacement and impact fracture, right, to the femoral head or to the femoral neck. I designed to do the operation for fixation in this case because of the fracture is not displacement and it impact. So there's chance of the healing by itself if we can do the rigid fixation, right? So I choose the implant that fixation to the bone, okay? Even though she's 76 years old, but the pattern of the fracture is no need to do the arthroplasty. At least when we success for the operation, the patient can get the own natural joint of her, okay? So this is 4 weeks after the operation, right? There's no collapse of the bone and the patient can move, can walk like the partial weight bearing. For the fixation, I recommend for about 2 months to 3 months until the bone healing before you put the weight on fully, okay? German male, 78 years old, okay? Fell over and contused the back and hip on the floor. This is like we call like the fracture intertrochanteric, okay, of the femur, right? This fracture pattern cannot do the arthroplasty. It indication for doing the fixation, right? So the thing that I've done is like I put the long nail and blade in the femur, right, to fix the bone and waiting about 2 to 3 months until the bone united. And after that, he can put the weight on and walk ambulation normally. But during the 2 or 3 months, he can walk, but walk with the walker, like the partial weight bearing, to prevent about the failure of the fixation because of the bone quality is not quite good, okay? The concept is like you put the pole in the mud, all right? The pole is strong, but the surrounding is not strong. So that means it can fail. So we protect the weight to help it a bit for a while, all right? At least about 6 weeks. Canadian male is like 87 years old, fell again. In this case, you see like the severe osteoporosis condition. I mean like the thin bone, all right? The bone quality is not good. This is the fracture. If you compare with the first case, all right? The fracture pattern is similar, non-displacement or mild displacement. But I changed about the method of the treatment. In this case, because of the osteoporosis and the condition in overall of the patient, the cooperate of the ambulation, I choose the hip replacement, all right? I use only one side of the hip. I didn't do on the acetabulum, but I do for the femur side, okay? And I put the cement grouting at the prosthesis to make it stable, and the patient can immediately weight bearing after the operation. Yep. This is to, improve about the quality of life and return back to the previous stage of the ambulation. Okay, this is our aim. South Korean, 71 years old, fell from the golf cart. So that means he can play golf, right? So he's still active. This is a fracture. There's like a displacement. So ideally, we need to fix it, but because of the fracture pattern, all right, I think that for fracture like this, if I fix it, it's gonna be fail, right? Because of the fracture pattern is not allow us to do quite well. So I changed the hip, but in this case, different from the case before, because of the bone quality is very good. So I use like the cementless, okay, to fit the prosthesis in the bone. No need bone cement to grouting it. So that means when it's healed, the bone ingrowth to the implant, that means the longevity of the implant is longer than the cemented, okay? Canadian male, 61 years old. He is quite active. He coming to Thailand to travel by himself. he fell and there's like a fracture here, right? He has like the underlying of the CA thyroid. He has like a problem of metabolic bone a bit. Okay. So in this case, I change the joint, like the total joint replacement I do on the femur side and on the acetabulum side as well, because of it's still 61 years old and he's still active. So I need the construction is too strong. If I do only one side, that's gonna be the metal wrapping on the acetabulum like the normal bone. It's gonna be protrusion later, all right? So right now, he can prompt to walk, all right? On another side, it's like the implant. On the femur is in the implant as well. So the longevity, it should be more. Going to the knee pain, all right? The knee pain is like that's come from the bone, cartilage, ligament, tendon, and bursa. It's similar like the every joint, all right? In every joint, you have like the bursa and soft tissue around there. So this is the muscle strain and bursitis condition, all right? It's similar with the hip joint. There's like the several muscle and tendon that form the knee joint and surrounding with the knee joint, right? Anastomose between the thigh and lower leg, okay? This is front and back, and this is like the area of the bursa, all right? So if you have like the pain and swelling of the knee, the job of the orthopedist and the doctor is like to differentiate about the fluid. Fluid is inside the joint or it outside the joint, all right? That it will gonna be recognized by the physical examination, right? And it will provide you about the different method of the treatment. For the treatment option, all right? If it's like the muscle strain and bursitis, you have to rest, cold compression, stretching exercise, immobilization. But for the immobilization, in terms of I advise to the patient, is like try to keep active. You can do everything that you don't have pain. If you have pain, that means you have to stop and decrease about the activities, okay? And take the oral anti-inflammation drug, muscle relaxant, analgesic drug, or painkiller if you need, all right? Fluid aspiration from the bursa. If the bursa contained with the fluid, for the aspiration, it's gonna be, like bring the fluid out, bring the inflammatory product of the fluid coming out, and less pain, less tension. Steroid injection, local treatment by the physio. This is like a ligament and meniscus injury of the knee. For the knee, it composed of the bone, all right? 3 bone, femur, patella, and tibia, right? And this is like the joint surface, okay? On the lateral, on outside of the knee, there's like the medial collateral ligament and lateral collateral ligament. This is from outside the knee joint. And inside the knee joint, you have like the cruciate ligament, anterior and posterior cruciate ligament, and meniscus that is perform the function as the ribum, all right? Make the joint congruent and stable, okay? When you have like the injury to the structure around there, so it's gonna be make like the cause of pain. Okay, the treatment option. For the knee pain, I prefer about the conservative treatment first, right? Prescribe the medication, take the physical examination, history or something like that. If the clinical is not good by the conservative treatment, I suggest to do the MRI, all right, to investigation to find out the exactly cause of the pain, exactly condition of the joint, and provide about the proper management, okay? For the surgery option in ligament and meniscus injury, we will do like the arthroscopy method or keyhole surgery, right? To repair and reconstruction about the injury of the ligament and meniscus. Yep, this is the picture of the arthroscopy or keyhole, all right? Yep, just give you an idea. Becoming to the fracture of the bone, all right? We use like the 2 options, like the conservative treatment and surgery, okay? For the conservative treatment, we use in the patient who has like the non-displacement fracture, or the fracture is like the just cracking or not movement. I mean, it's like the not displacement. and has the good congruence of the joint. The surgery, we will consider to do that in the intra-articular fracture involved with the joint surface to realign the joint surface and alignment of the bone and joint. The benefit that you can get from the operation or from the surgery is like early mobilization and early ambulation. Next, please. This is the sample of my case, all right, for the fracture femur. This is intra-articular fracture and displacement and involved with the joint. The thing that I've done is like the fixation, go inside and realign about the bone, okay, and joint surface, and fixation, waiting until the bone united in about 3 months. This is like the tibia fracture, right? This fracture line is here and coming down to here. This is non-stable, it is unstable fracture. If you choose about the conservative treatment, that's gonna be during the healing process, the fracture can collapse and make the joint is not congruent. So I use the fixation on the medial and lateral plate to fixation. After the operation, in this case, the patient can move the knee like the full motion because of the structure of the fixation is strong enough to mobilization, right? And partial weight bearing for about 4 weeks. This is the kneecap fracture, right? We use like we call like the wiring, okay, and tension band, okay, to make the kneecap coming back to the position and allow the patient to move maybe about, after 2 weeks, 4 weeks, 6 weeks, step by step. This is like to prevent about the stiffness of the joint during the treatment. Final one is like the gonatosis, like the arthrosis condition or degeneration of the knee joint. It's like the progressive degeneration or wear and tear of the cartilage of the knee joint. Okay, we call arthrosis condition. This is the normal cartilage, okay? It's like smooth and lubricant, all right? It's smooth when you move, but when you have like the arthrosis or degeneration condition, the wear and tear of the cartilage is gonna be make your knee move with the sound, like the crepitus sound or feel like the bone on bone, right? So this is the cause of that. And when you have the condition of the wear and tear of the cartilage, that's gonna be produced about the inflammation process and cause of the pain. Plus with when you have the degeneration of the cartilage and knee, your axis of the knee is gonna be changed. So that means it will produce about the mechanical problem as well, right? This is my patient, Thai female, right, 74 years old, right, suffer with the both knee pain for several years. In this case, she designed to do the bilateral knee replacement at the same setting, right? So I do like the both sides at the one setting, okay? We can realign the bone, the leg in the proper position and, collect and cope about the problem of the knee pain, okay? The recovery time is about, like the 5 to 7 days in the hospital, right? She can move her knee, she can walk with the walker for about 2 to 3 weeks. And after that, progressive weight bearing and, walking back. Yep, this is like the final one, all right? 75 years old as well. She came with the bilateral knee pain and malalignment of the knee of the leg. I do like the both knee replacement at the same setting as well. I'm lucky in Bangkok Pattaya, we have like a good team to take care for the elderly patient, prepare about the medical condition of the patient before go on for the long operative time, right? And after the surgery, we have the team like the rehabilitation to make the result is better to take care post-operative, right? So that means we have the team that prompt for go on for the complex of the surgery, okay? Okay, thank you.
Thank you so much, Dr. Nammon. What we'll do is we'll have the second speaker, Dr. Chat, who's going to talk about rehabilitation. And Then we'll get them both back to answer any questions you might have. By the way, we've got, like some actual rehabilitation sort of exercise after Dr. Chat as well. So welcome to Dr. Chat. Thank you. And he's going to be talking about rehabilitation.
Thank you. Okay. Today I will talk about a physical modality of musculoskeletal pain, about the hip and knee pain. Anyone have been used their physical modality machine? Okay. Today we will talk about what is the machine that we use is to relax the muscle. But if you have the severe degeneration or fracture, maybe you need to see the orthopedic doctor. Not gonna want to operation on. Okay. This is our department. Our department have their physical therapist, occupational therapist, and the sports scientist to get you to the recovery from the pain. And we have the 10 treatment room. There is a full function modality. Okay. It's the privacy room for you for treatment. Okay. Today we will talk about the machine that we will use is to the patient, like the ultrasound therapy, the shock wave, the magnetic stimulation, the high power laser, radio frequency machine, extraction, and the short wave. What is it and why we choose it for the patient? And the most important is the contraindication for that machine. Okay, if you have some contraindication, maybe at the first we will ask, you have the cancer, you have the pregnancy, or another contraindication. But if there's something you can tell us to choose it for you. Okay, thank you. Okay, the first of all is the ultrasound therapy. The ultrasound therapy is the ultrasound machine to get the ultrasound wave to get the deep heat for you at the point at maybe the knee or the hip. Okay, to get the tissue relaxed. The contraindication is if you have the implant, like the plastic material in the joint or joint cemented, or the malignancy, or the uterus. If the pregnant, we cannot use it. So if you have the cemented hip arthroplasty at the hip, and so you have the hip pain, so we cannot use the ultrasound at the hip. Okay, so we will choose it for you. Maybe we choose another machine for you. Okay. Okay, next one is the shortwave diathermy. Shortwave diathermy is the machine that converts the electromagnetic wave energy to the thermal effect, to the thermal energy. So get the deep heat to the heat, relax the muscle and the tendon for that area. Okay. That machine is have the head of the machine and get the magnetic energy to that joint or that muscle. Okay. The contraindication of the shortwave diathermy is the most important is the metal implant malignancy on the pregnant uterus. Okay, so if you have the metal implant, maybe you tell us. Okay, if you have the knee arthroplasty, you tell us that you have a knee operation, so we cannot use some machine for you. Okay, we will choose another machine for you. Okay, or malignancy or cancer or the pregnant uterus. Okay. Okay, the shock wave. The shock wave is this machine is a shock wave. Okay, it's a high intensity pulse mechanical wave with the low repetition frequency to get the mechanical wave to get the energy on that area that we want to relax the muscle or tendon in that area. Okay. Another one is the high power laser. The laser is the light to get the area to decrease the inflammation caused by change in the activity of inflammation mediator. Okay, it's the light to direct in your muscle, skin, or the bone area. Okay, the laser can change the nerve conduction or activity and stimulate collagen metabolism and wound healing. Okay, this is the picture of the laser. Okay, the importance of the laser that the operator, the therapist must and the patient need to wear the glasses because the laser can be affect to your eyes and retina damage. Okay, you need to wear the glasses. Okay. Okay, the next one is the peripheral magnetic stimulation. Is the the machine that creates the magnetic field to induce the ion and the flow to get the nerve contraction. If you do this, maybe you feel the some contraction of the muscle and the nerve. You can feel the some contraction. Okay, it stimulates the neuron to get the some contraction of the muscle to relax the muscle and the tendon around that area. Okay. Okay, the indication of the peripheral magnetic stimulation is the myofascial pain syndrome, low back pain, post-traumatic peripheral nerve, and the neuropathic pain. If you have some numbness and the shrinking sensation on your leg and your arm, maybe you can use this machine. Okay, so we will choose it. We will choose for you. You tell the symptom to us. Okay, but the contraindication is the same. The pregnant uterus. So if you have the pregnant. The lumbar spine or abdomen we cannot use in that area, or the metallic implant. So okay. Next machine is a radio frequency machine. It's a high frequency electromagnetic energy to get the heat in the tissue. So it induce the thermal effect in that area. Okay, promote collagen production and the muscle relaxation. Okay. Okay, this is the picture that what we do for the radio frequency machine. Okay, it's the head of the machine to get the massage and get the heat in the deep tissue. Okay. Okay. Okay, now is this example for the machine that we will got to the patient. The most important is if you have some metallic implant or the history of cancer or another some chronic condition, maybe you tell us. So we will choose the proper machine for you. Okay, okay, and then and if you have the severe degeneration or you need to operation, you need to see orthopedic doctor. The physical therapy machine cannot be too much. Fix the bone fracture, cannot fix the bone fracture, and if you have severe degeneration, the physical modality cannot heal that. Okay, maybe the operation is a need. Okay, okay. Next one, we have the sports scientist to some exercise for hip and knee pain. Okay, maybe you can get some exercise and do by yourself at your house. Okay, next is welcome the Go is a sports scientist. Okay,ครับ.
Good morning, everyone. I am a sports scientist from Rehabilitation Center at Bangkok Hospital Pattaya. My name's Kietisak. You can call me Go. It's easy for you. Okay, so before we start today, I will ask you a quick question. Have you ever feel about stiffness on your hips or your knee sometime or not? Yes, if you have, yeah. That's very common because everyone is get older. The muscle will weakness or something. So today I will recommend you two easy exercise, 3 easy exercise and 3 stretching, easy for stretching. Okay, you can bring this for you at your home and at your gym. Okay, the first one is this exercise, I think everybody at here do every day. Okay, this is very simple. Okay, you sitting on the chair. The first one is strengthening on your thigh and your hips. You sitting on the chair. Let's try together. Okay, sit on the chair and keep body straight. Yep, and set up on your foot. Same your hip line. Okay, not wide, not narrow like this. Same your hip line and keep body straight. Please don't use your hand if possible. Okay, if not stand by yourself, you can push a little bit your hand. Okay, before you stand up, please don't lean your body forward like this. Okay, please don't do. It's not good. Focus on your thigh, on your muscle. Okay, use the muscle. Take body up, push up like this. Shoop. Yeah, if harder, you can push a little bit from your hand. Push your body up, shoop like this, and then breathe out when you stand up, and then back, going down slow. Breathe in, focus on your muscle and your thigh. One more again. 1, 2, 3. Push up. Yes, and then going down. Feeling on your muscle or not? Yes. Okay, this is a very easy to do every day. You can do, I think, 20 times. 20 times is okay. For, I think, 2 or 3 sets is okay every day. And next, this is easy also. Sitting comfortably, back rest. Okay. And curl your ankle a little bit. If you do on the left, you can curl your ankle on the left and then kick up your leg in front like this, feeling on your thigh. Okay. And then down. Focus on your thigh. Kick up slow. Hold 2 or 3 seconds. Yep. And then go down. You can feeling on your thigh? Yes. Do it again 2 times. 3, 2, 1. Kick up. And then go down. When you kick up, breathe out. 1 more. 3, 2, 1. Kick. And then go down. Yes, very easy. And the third one is strengthening from your hip. If you lose of balance, you can find the chair or something to hold for support your body. Okay, I will show you on the left side, right side. Hold the chair and keep body straight. And then on the right side, keep straight. Kick by your side like this. Focus on your hip. Okay, not your calf, not your thigh. Okay, focus on your hip. Squeeze your hip and then kick by your side like this. And then back. Do it slow. Yep, like this. You can try. Yeah, thank you. Let's try together. Do it slow. Focus on your hip. Squeeze your hip and then kick by your side. And then back. Do it slow. If you're feeling on your hips, you do is correct. If you're not feeling, it's not good. Okay, focus on your hip more. Squeeze your hip and kick by your side like this, and then back. If you lose balance, you can hold the chair for support. Okay, be careful, you're falling. Okay, and next is for stretching exercise. Stretching is very important also. The first one, I recommend you to do the stretching exercise. Hold the chair for support your body, okay? And then bend your knee like this on your back. If you lost a balance, okay? Bend your knee and then use your hand, pull your ankle to your buttock until you feel straight on your thigh, okay? And keep normal breathe like this. If you lost of balance, hold the chair is very important. Okay, be careful, you're falling. And then the second one is stretching for your hamstring muscle. Same, hold the chair for support. One step, yep, forward like this, and then lean your body forward. Bend your knee a little bit. You can feel on your thigh. Yeah, you hamstring straight. Keep your legs straight all the time. And normal breathe in and out. Okay, breathe. Don't hold your breathing is good. Yes, and then each side. Okay, not do the one side. Okay, you need to do both sides. And next is a little bit difficult for stretching your calf, but I think everyone can do. Same, hold a chair like this. And then one step, go far back like this. Focus on your heel, on your back foot. Press your heel on the floor. Please don't open like this. Press your heel on the floor and then find something to hold for support your body. Bend your knee on the left a little bit. Keep your right side straight and then lean body forward until you feel on the calf state. Okay, you can feel or not. I have one choice. It's easy. Oh, I cannot do that. Okay, find the wall or something. This is a wall. Okay, this is a wall. Find something the wall like this. You curl your ankle on the wall like this. Keep your legs straight and then lean your body a little bit. You can stretching on the calf also. Yes. That very easy 3 exercise and 3 stretching I will recommend you. I think you can do every day, make you stronger and move better. Okay, thank you very much for today. Thank you.
And of course, the video of that will be up on YouTube eventually. And so we will, so you can go there and revise the stretches. They were really quite sensible. Are there any questions? Yes. Okay, great.
I must, first of all, on behalf of us all, congratulate you and the young gentleman that's just sat down. What a brilliant presentation, the best one I've ever seen. Thank both of you. I have a couple of questions. Sorry, sit down, take a rest. If you're doing a major replacement of a hip joint, particularly when you're driving a spike down or replacing the actual joint and the ball, how long does that actual joint stay, considering our age? I mean, not my age, I'm older than everybody here. How long?
Yep, you mean like the longevity of the joint replacement, right? Yep. For the implant, mostly we expect about, like the 10 to 15 years, okay? It's not everyone has to have like the, like the loosening or failure or loosening. It depends on the bone quality. It depends on the surgeon who can put the implant in the proper position. It depends on your activities as well, right? And in general condition. But by the research, by the, like the digit, by the research of the implant, about, 12 years, there's like the chance or number of the patient who has loosening or has like the chance of the revision in terms of the loosening or deteriorate of the artificial joint more, right? The number is more, but not everyone, right? I can say that, like about, 15 years, it should be okay. But there's like the several patients that has like 18 years, 20 years, it can happen, all right? But the rate of the revision is higher after about 12 years.
Thank you, doctors. Very impressed.
It's sort of up your field, actually, isn't it?
Do you see any value in the routine daily replacement with glucosamine, or is it hocus pocus?
Yeah, I will like to talk about, like the cause of the pain, all right? Cause of the knee pain and hip pain. It's composed with the 2 causes of that. The firstly, that's come from the mechanical pain, all right? The mechanical pain produce the chemical pain. That's like the inflammation. I always told my patient that you got like the 2 kind of the pain, all right? For the medication, it can cope about the inflammatory or chemical problem. But any injection, any medication cannot cope about the problem of the mechanic pain, right? So for the hyaluronic acid or something, glucosamine or whatever, right? It can cope about the problem of the chemical pain. But if your condition is beyond that, I mean like there's like the mechanical problem already. So I think that the expectation of the glucosamine, hyaluronic acid, steroid injection is lesser and lesser.
About 10, 11 years ago, I had a meniscus sewn back together, and the doctor in Bumrungrad showed me that there was not a huge amount of cartilage. The cartilage was deteriorated. There's nothing that I'm aware of, and maybe you would correct me, that will help the cartilage to rehabilitate. And the second question is, when you're stretching the knee, like the man just showed you, many of us Westerners don't bend our knee as much as the Thais do through most of our lives, let alone when we get older. So if you were trying to stretch the muscle there when you've had some osteoporosis of the knee, how much should you try to bend the knee? For me, for instance, it doesn't go that far before it starts to be painful, and that pain, I would think, is an indication I shouldn't go further. But so that's the two questions. Should I go further in stretching it? And secondly, is there anything that helps to build up the cartilage at this point in medical advances?
Okay, if you have the meniscus injury or the osteoarthritis, the stretching on the knee just that's great. Okay, if you flexion on the knee more than the 90 degree, we will got the stress on the knee. So you stretch such as gently that you feel there's some a little bit stiffness. Okay, that and hold on about the 10 seconds. The standing position is not good for stretching because if you're stretching here like this, the knee is a flexion more than the 90 degree. That's great. Okay, so maybe you are lying down and a little bit stretched by the another assistance. Okay. In the standing, and this is not good for the osteoarthritis patient if you have the severe or you have a few stiffness of the knee. Thank you. That's for the question. Okay.
And the regeneration, is there a machine that helps with the regeneration of the tissue?
The machine can be relaxed and some regeneration of the tissue, the muscle. Okay, but if you have the meniscus, it cannot. If you have a degeneration of the meniscus, maybe operation is we will see the MRI result first, and maybe the operation is an option. Okay.
So he was specifically asking about the cartilage rather than the meniscus. So is there machine that might regenerate the cartilage, he was asking?
It's a little bit regenerative of the cartilage. The machine can be, but it's not too much.
Which machine is that?
Maybe the laser can be a little bit, because the laser can have a regeneration of the tissue.
And that electromagnetic machine, is that a PEMF machine, pulsed electromagnetic field?
It cannot. No.
All right.
Yep.
Yeah.
For the, I can tell you about the, answer you about the question of the regeneration of the cartilage. In terms of the cartilage, regeneration is less likely, all right, because of when you have like the healing process of the cartilage, it's not like the real cartilage. It's like the fibrous tissue that is cover the defect area. So when you have like the cartilage damage or lesion, the healing process is not the same as the new cartilage. It's like the fibrous tissue that cover on that. So that's why it's weakening and it can prompt for go on for the degeneration further, right? Yep.
I know this is probably a very difficult question to answer, but I've got accident insurance which covers me for 300,000 baht. Would that cover me for instance, for a hip replacement? 300,000 baht.
I think he's asking about the cost of a replacement of your hip, is it?
Yeah, hip.
Any idea about the ballpark figure for a hip replacement?
For the price, right?
Yes.
In Bangkok Pattaya Hospital, it's like about, it depends on, like the...
Yes, I realize that, yeah.
But, like the, for roughly that, that I ever seen it, like the quoting from the hospital is like about 400 to 500,000 baht for...
Right, I need to increase my accident insurance. Okay, thank you.
Okay. Great talk, and thank you for coming. 2 quick, easy questions. From your chart on the knee, I only saw ligaments. Does the knee only have ligaments, or does it have ligaments and tendons? Second easy question is, what's the difference between a tendon and a ligament?
The tendon is like the area of the, like the muscle that transform itself to the tendon, to be the tendon, to attach the bone, right? And for the ligament, it's like the collagen is another kind of the soft tissue that it not like transform to the muscle. It's like the ligament by itself. It's like another specific of the soft tissue that attach from bone to bone. Yep. This is the difference of that, and it different function as well. For the tendon, it can has like the like the elasticity, all right, for like the movement, like the muscle done. But for the ligament, the main function is like to make the stability of the joint.
Great work, you guys, for the presentation. And Doctor, your surgery, I've been building things all my life, and your work is clean, man, as a whistle. Beautiful. But I want to talk for a minute about cartilage regeneration, and 2 points I want to make. In November 24, there was research that came out of the university, Northwestern University in Chicago. He came up with a substance that I believe had to still be injected at the point in knees. He was working on knees that really help regeneration of cartilage, or at least making it better. But even more recently, like this month, out of China, there's been research. They research people getting Ozempic, the one that starts with an S, in 0.5 milligram dosages weekly against the blind, and they had percentage of measurable improvement of new cartilage growth. So that's just something looking forward to. It was a small study, only 20 people. But the greatest thing is if we could alleviate having to have surgery done, especially for just tissue regeneration. But anyway, that's all I wanted to say. But yeah, your work's beautiful, Doc. Good work. I hope I never see you.
I hope I never see you.
A long time ago, my mother had problems with her knees, and she was tempted to take a treatment which was based on bee venom, the ejection of bee venom into the actual joint itself. Has that gone by the board now? Is it still used, or is it something that's just forgotten about?
Have you ever heard of this, the injection of bee venom into the joint?
That I back to my basics already. Yep. If you have the wrong mechanic already, I don't believe about like the some kind of the injection or any medication that can collect about the mechanic. All right. The pain or like the knee and hip is composed with the that I told you chemical problem and like the mechanic problem. All right. Whenever you have like the migraine of the inflammation, okay, you can try everything like the injection, medication, or anything else, right? But whenever you have like the osteophyte, you have like the narrowing of the bone of the joint already and wrong mechanic already. I don't think the medication or any injection can interposition or can heal or can collect with the mechanic that goes wrong. Yep, this is my basis.
All right, well said. We are done for Q&A, but we aren't done thanking you so much for your talk. Dr. Chat, I'm so impressed by the number of machines you have, by the way. Come over here, Dr. Nammon. Stay here, we'll get some photos taken for posterity.
Thank you.
So thank you again. Your second talk at the club. Thank you again. Thank you.
Okay, today we have 5
Do you want
prizes
the doctor to come up and
of
do the
lucky draw, and please the doctor, 2 doctors on the stage. The first 2 prize is MRI, but one region. It's like shoulder, cervical spine, lumbar spine, thoracic spine, thoracic lumbar spine, and knee.
But firstly, I have to interrupt you. Everyone, big round of applause for Kunjis, who organises these mornings from Bangkok Hospital. She's fantastic. Thank you, and thank you.
For MRI, we have 2 prizes today. If you have seen the doctor before and the doctor recommend you to have the MRI, then the voucher will be beneficial for you. Then the first prize by Dr. Nammon. Number?
I like this number. 27.
27. Come on, please.
Come on up and have your moment in the sun. Oh, this is a lady who really wanted to win something.
Coaster. Okay, please be on stage, please.
Stay there. Stay there, Pat. We'll get it to you. Don't worry.
And MRI number 2. Number
23.
23.
23. Okay.
Oh, here we go. These, yeah, this is cool. I think.
Please give a round of applause to our winner. Come up the stage. Can you come up the stage? Maybe difficult or not? Okay, thank you. And next. Okay, it's this relief pain package. We have 3 prizes today. Relief pain package is you will have hydrocollector and ultrasound interference. We will be using like a heat pack or ultrasound to improve your blood circulation and muscle relaxation, right? Okay, please, Dr. Shad ค่ะ3 ใบเลยค่ะ 3 prizes.
Number 41.
Number 41.
ขอบคุณค่ะ Congratulations. Yeah, can you come on stage? Up by the doctor. Okay. Thank you. Okay. Next.
33. Sorry, 34.
34. Number 34, the winner.
Hey,
Congratulations. Okay. For you. Thank you very much. Congratulations. And the last one.
21.
21. 21. Okay. Yeah. Give applause. Yes. Mr. Carl Han. Okay. Okay. Congratulations. Okay, that's it.
Yeah,
Thank you very much, Doctor.
Another big thank you to Bangkok Pattaya Hospital for an amazing morning.
ขอบคุณค่ะ